Along with testing, contact tracing is considered a key element in fighting the continued spread of coronavirus. Statehouse correspondent Andy Chow has details on the state's contact tracing efforts.
Contact tracing is a process used to combat infectious diseases. Health experts talk to people who test positive for COVID-19 to identify others who might have come into close contact with the individual who has the virus. Officials then notify those people with self-quarantine instructions to stop the potential spread of the virus. Joanne Pearsall says this process, combined with ramped-up testing, is a vital piece to Ohio's COVID-19 response plan.
The sooner we can identify the contacts of those people, the sooner we can interrupt that chain of infection. So if too much time passes between the positive test result and identifying those contacts, you lose the window of opportunity to intercept the chain among those contacts. So the closer those two things can be together, the more successful we can be with interrupting that chain of infection.
The state oversees the effort from a wider perspective by providing what she calls 4 buckets of resources.
So the first is the human resources bucket. So finding the people to fill the positions and everything that goes along with that. The screening, the interviewing, the hiring, the onboarding, all of that is in the human resources bucket. And then we have our training bucket. So we're equipping these people with knowledge and information and resources that they can refer to in the course of their work, orienting them to a little bit about public health and what public health is and contact tracing in particular, and our processes here in Ohio and with the state health department. So that's the second bucket, training. The third bucket is IT. We had to make sure these people had secure internet connections so that they can access the programs that they need, that they have access to a phone line, a common phone line to make these outbound telephone calls, and to make sure that they have access to resources for troubleshooting purposes as well. And then the final bucket is media and communications. Our communications department is helping us to develop some messaging around what people can expect with contact tracing and what they can expect when they get if and when they get a call from either their local health jurisdiction or the state health contact tracing pool.
If someone is identified as a person who came into close contact with a confirmed COVID-19 case, then officials will contact them.
In our pool that we're developing, it's primarily a one-on-one connection. So someone who's infected identifies where they were and at what time and who they might have been in contact with. And then we call those people, let them know that they were potentially exposed, and ask them a series of questions so that we can monitor and they can monitor their own health status and health status of those around them.
As Pearsall explains, contact tracing is a process that's been used for decades to address infectious diseases. She says gathering the information is not about prying into personal lives, but to help protect people's health.
This is really about protecting people and notifying them that they've been exposed. It's not about keeping a record of where they've been or who they've been with or for how long. It's not about getting in their business. It's about protecting health.
While contact tracing is voluntary, it's also strongly recommended by the state. Pearsall says social distancing can play a big role in breaking the chain of close contact. When contact tracers ask people with COVID-19 who they may have exposed, they're looking at space and duration of time. Close contact is defined as someone who came within 6 feet of an infected person for at least 15 minutes. The timeline for when that close contact happened can vary depending on if the infected person is showing symptoms. Andy Chow, Statehouse News Bureau.